All right, welcome everyone. Thanks for joining us for this exciting session. We're going to be talking about public health communication in times of crisis. I don't think we could have a more timely topic these days with so much going on. It truly is a moment for public health in our country, and so we're delighted to be able to have this session tonight. I want to send a special shout out to our new students and incoming students. We are delighted that you're here with us to share this special topic. And we also want to invite you to our, we're calling it the after party, a student led discussion only for students. Sorry, Tom, you're not invited to the party. All of us old folks are going to get off and let you as an opportunity for you guys to really bond as students and come together as a community here at Hopkins. So with that, I am going to pass it off, and I also want to thank the Student Assembly and all of our speakers for their participation tonight, but the Student Assembly has partnered with us, and also thanks to Jennifer Baker, who's organized our student leaders, and you will see students will be taking the lead on moderating and introducing our speakers and asking questions. So we encourage you guys all to participate. I am actually going to have to jump off the session, but I know you're in great hands. All these guests are professional speakers, and you will have an amazing session. So again, I want to welcome you all and thank everyone and have a great session. And passing it off to Jennifer. Thanks so much.
Wonderful. Thank you so much for the introduction, Beth, and thank you all for virtually being here with us. The intention of this series is really to provide a platform for new and incoming students, as well as the broader Bloomberg community, to come together surrounding topics that are important for the moment. And like Beth shared, communication in a time of crisis is a very timely topic. And so we're thrilled to be here and thrilled to be joined by a representative from the Student Assembly. And so I'd love to pass it over to Pratibha. Pratibha, the floor is yours.
Thank you, Jen. Hi, everyone. I'm Pratibha. I'm a rising second-year PhD student in the Department of International Health. I'm a Student Assembly rep for today, and joining me, I'm sure she's somewhere here, is the president, Priya Khaitan. Hi, Priya. Welcome to our new students and to our former ones as well, and our current ones. So let me give you a brief overview of Student Assembly before we move on to today's session. The school has ample opportunities to get involved beyond the classroom, and Student Assembly is one medium, and it's basically the main student organization. So we're a group of students within the School of Public Health, and our mission is to represent and promote the interests of all of the students in this school. So we act as the bridge between school leadership and the student population and work to make sure that policies and regulations reflect the needs and the rights of the students. And beyond that, we also offer a ton of educational, intellectual, and social opportunities for students to engage in, which is particularly important right now, given the virtual aspect that we're all in. And so to get involved, you can run for the fall elections or summer elections, attend our monthly meetings, or start a student group or join some of the existing ones. So there are a lot of conversations that need to be held right now and communicated appropriately. And that's one of the main reasons I'm really excited to listen into today's session. And one in particular that the Student Assembly is working diligently towards is racism, and how we can be more intentional in being actively anti-racist. Because racism is, after all, a public health crisis, and we've definitely seen how that has panned out with COVID. So we at Student Assembly have a committee called Diversity, Equity, and Community Affairs that we've revamped to address the current pressing issues. This committee is and will be working closely with the Inclusion, Diversity, Anti-Racism, and Equity DARE committee, with our VPs serving on this committee. And together, we're putting together a strategic plan to address racism, and more importantly, we'll be working to implement the plan. And so we're hosting 3 sessions to gather student feedback on what that can look like. One is right around the corner on July 28th, and the others will be held in August. And these sessions are from 5 to 6:30 and will not be recorded, and that's one way for us to make sure that people feel as comfortable as possible. So we really want to welcome all ideas from you and current students to help us figure out how the school can best move forward to foster a more diverse, equitable, and inclusive environment, and how we can use our space and platform more intentionally. So if you'd like more information on any of this, or if you're interested in joining Student Assembly, please feel free to reach out. I will post my email on the chat. And so for today's panel, you will hear from a number of panelists, and they will start off the session with their individual presentations, and then we'll follow that up with Q&A with student leaders that are currently actually located all across the world. And we'll be talking about some of the tensions that the field of public health has always had when it comes to communications, but particularly evident today with the multiple crises that we're facing. So with that, I will hand it off to Jen.
Fantastic. Thank you so much. And a really, I think, unique feature of this session is that the series is that each session is co-led by student leaders that have reached out and applied to help to lead these sessions and given some of their time to meet with the leaders and panelists in advance to help explore how to make this session as great as it can be. And so we're really thrilled to have the opportunity to work with the students and to have the students introduce themselves and the panelists. So with that in mind, I'm going to transition over to our first student co-leader, Hyang Lee. Hyang, the floor is yours.
Hi, good afternoon. I'm Hyang Lee Tan from Kuala Lumpur, Malaysia. I previously worked at a women's rights NGO in Malaysia, where I led advocacy campaigns to improve public policies on gender-based violence and gender equality. I was drawn to this session because in my work, I often felt the tension between advocacy and academia. As an advocate, I had to simplify messages when engaging the media, and at the same time, I often wondered how to retain nuance in public communications. I'm excited to hear from our panelists today about how we as public health professionals can communicate effectively, especially in times of crisis. Our first panelist is Lymari Morales, who is the Associate Dean for Communications and Marketing at the Johns Hopkins Bloomberg School of Public Health. In her role, Lymari shapes and promotes the Bloomberg School's brand at the local, national, and global level. Prior to joining Hopkins, Lymari served as the founding leader and the chief editorial advisor at Atlantic 57, the strategic communications consultancy of the Atlantic. There, she led a team of journalists and digital strategists to develop and execute communications and marketing strategies for many organizations, including the American Cancer Society and the American Medical Association. Prior to joining Atlantic 57, Lymari led editorial and digital efforts at Gallup in Washington, D.C. She spearheaded the organization's efforts to translate complex global research into accessible public communications. She brings a journalist lens to communications leadership, having also worked for major news outlets including NBC, MSNBC, and Fox. Lymari received a Master of Public Policy degree with a concentration in international security from the Kennedy School of Government at Harvard University. Thank you, Lymari, for joining us. The floor is yours.
Thank you so much, Hyang Lee. That was a wonderful introduction. Thank you so much. And I'm so thrilled to be here. Thank you for the invitation to everyone. As Hyang Lee mentioned, I'm our Associate Dean for Communications and Marketing, and I joined the school about a year ago. So I haven't had too many opportunities to interact with students. I've had a few, but each one is just very exciting for me. And also in my role, I oversee our external communications as well as our marketing to prospective students. So I hope that many of you, both new and continuing students, have seen some of the work that's coming out of our group. And I'm excited to kind of talk you through and kind of share a little bit more of the behind the scenes of some of the content and communications that we have been producing during the COVID-19 era. Broadly, before I jump into that, I'll say, where I've really focused my career in recent years is at the intersection of complicated material and helping knowledge-rich, mission-driven organizations share their knowledge with the world. And so an organization like the Bloomberg School of Public Health with so many brilliant scientists, researchers, students, and so much incredible work coming out of this organization, it's truly my dream job to help share that information with the world, and to turn people's attention to things that they maybe aren't paying attention to and should be paying attention to, but also in a situation like where we are right now to help answer questions that audiences have, to correct misinformation, and to really just add value to the global and national conversation. The team that I oversee includes strategists, both content and marketing strategists, as well as an editorial team, which of writers and reporters who produce articles, a magazine, a video producer, as well as designers, web developers, social media, media relations, and marketing. So all of those different aspects come into play when we think about how do we take all of the knowledge that our organization has and share it with the world, and also hopefully compel people to either want to follow our work, share our work, or potentially come to study here, or join us as a faculty member, or join us as a partner or donor. So we're always thinking about both of those, informing and also kind of attracting people, pulling them towards us to work together on shared goals. So I know this session is called Public Health Communication in Times of Crisis. And so I thought I would share my screen and walk you through some of the communications that we have put together through the COVID era. And really, as we approached this moment, but really every day, what we're trying to do is bridge the gap between what we know as an organization. When I say we, I mean all of the amazing, brilliant faculty, researchers, scientists, students, and what audiences want. And so our communications team is really helping to be that translator or that bridge to really understand what audiences want and are looking for, what questions they have, and to translate the knowledge of our institution. And it's both proactive, things that we want people to pay attention to, as well as answer questions that they have. So with that, I'm going to share my screen, and I'm going to pull up what we call our School of Public Health Experts Insights page. This is just one click off of the main homepage for anyone who's just wondering how to navigate here. So this is on our homepage right now, and it says explore our COVID-19 coverage, and that brings you to this page. And this is a page that we stood up the first week of March. So as the pandemic was quickly escalating, we realized we were going to have to cover this topic fast and furious, and that we would need kind of a one-stop shop. And we launched the initial version of this page in just 2 days' time. The same week that we had an inaugural live webcast out of our studio, and the same week that we decided to launch a daily podcast. So that was the first week of March. We really realized this was going to be big and require a lot of attention, and we needed a digital home, and we also potentially needed more formats. I can tell you our current website, in case you're wondering, has some technical limitations, so we're doing pretty good. We're also working on a website redesign for a future new website, which will be even more modern and give us more technology options. But I wanted to point out a couple things that we did. One thing is we really stepped up article production. So all of these are articles that are produced not only by us at the school, but also Crystal's group, the Center for Health Security. We highlight their articles and reports, as well as Q&As. And so just to give you some context, our school was not producing nearly this amount of article content on an ongoing basis prior to the pandemic. It was more, we have our magazine and we have a product called Global Health Now, but we stepped up basically anywhere between 2 and 5 articles a week to share the knowledge of our institution and to answer questions audiences have. As I mentioned, we also launched a daily podcast, Public Health on Call, which you can subscribe to. And this was a new format. We figured it was a very easy way for people to consume information, kind of one topic at a time. And Dr. Josh Sharfstein, who's our Vice Dean for Community Engagement and Public Health Practice, was open to being our host and diving in with us. And we started producing a daily podcast again the first week of March. And we're up to 120 episodes at this point. We were actually at more than daily for part of the peak period. We've come back down to daily mostly to retain the sanity of my team, not because we've run out of topics. But this has been really exciting, and we've had more than 1.5 million downloads of our podcast. And each one is usually about 12 to 15 minutes, a short interview with 1 to 2 experts maximum on one topic. And I'll come back to the name of the podcast in a second. I also want to highlight, we did not have a daily newsletter product prior to this, and it was something I knew what we wanted. But as soon as we noticed the interest level in COVID-19 coverage from our school, I saw the opportunity to create some sort of way for people to subscribe, because in asking them to subscribe, we're able to push information to them in an ongoing fashion, and also to retain them after this is over. And part of where my brain right now is serving this moment, but also planning for the long term. And how do we stay and keep audiences that are with us right now, but eventually and hopefully this crisis will be behind us, but we're interested in introducing them to other topics or other areas of expertise from the school. How do we do that? We built a subscription product that would allow them to subscribe. And now we send it, it's actually every other day now, Monday, Wednesday, Friday, but we send them a newsletter. And what this means is we've now built an audience of people who will continue to receive content and information from us even after this moment. We launched this newsletter on March 17th, and as of yesterday, we had more than 55,000 subscribers that we've been able to build in a couple short months. We originally called it the COVID-19 Daily Roundup, and it was daily. And the vision was that it was really hard to keep track of everything coming out of our school because we had articles, we had the podcast, our experts were tweeting on social media. And if you wanted to stay on top of all of that, our Center for Health Security is putting out reports. You'd have to kind of bounce around to a lot of different places or come to our new page. But this basically allows you to get the podcast, find out what's happening across social media, learn, see important tweets, and this also includes our news mentions. So it was really meant to be a one-stop shop product that would make it easier for audiences to stay up to date on everything coming out of our school, but also gives us a way to hold on to these audiences beyond the pandemic. A couple other things, mainstream media is still a big part of our strategy. And here we have our in the news mentions. And so our experts like Dr. Watson and others are quoted constantly in other media, and we highlight that here. So this is the content produced by us, and this is the mentions in mainstream media. And our experts have also done a lot of op-eds during this period, which are another way to reach audiences. So I think the big picture here is we employed a lot of different formats and a lot of different platforms in order to share knowledge in different ways that will work for different audiences, because some people really prefer to read articles and some people really prefer to watch videos. Some people prefer to get things on social media, and we had to deliver on all of those different formats and reach people in different ways. Jennifer asked us to share some tricks of the trade. And so I thought about what tricks of the trade did we employ in doing this. So one is to know what your guiding principles are before the crisis strikes. So, in a crisis, you can kind of be caught off guard and say, I have to change everything because there's a crisis. And I think it's important to kind of know what your principles are and know what you stand for before the crisis strikes, so that you can just apply those principles to that moment. So last year when I had first joined, I documented a strategy, and I had outlined these goals for our group. One was to establish the school as a go-to trusted source of public health information for a broad audience. And the other was to attract prospective students, faculty, partners, donors, etc. And so we knew that those were some of our goals that we were trying to achieve in this moment, and we could simply apply that vision to this moment rather than try to say, oh, we got to throw out our old playbook and we need to get a new playbook. We really were just activating our playbook, but applying it to COVID-19. Second tip is to figure out how to stand out from the crowd. We had, of course, every media outlet or every organization, every school of public health is covering this topic. And we only have limited time and resources and hours in the day. So we also needed to have a filter to say, what should we spend our time on? What are the things we want to produce? And so we set out clear criteria. We knew that the content coming from our school would be powered primarily by the knowledge and evidence of our experts. So if it was someone else's knowledge, that's, let them report about it. And the second would be that it answers questions that audiences have or addresses a gap in the conversation. And so when doing so, there were times where our team pitched ideas and I would say, well, if CNN could do that story, I'd rather not spend our time doing it. I'd rather spend our time doing things that only we can do, because that also helps to shape how our brand is perceived and what people expect to find from us versus another organization. And it also just helps you channel your resources, which are always limited no matter who you are. And the third is to think both short-term and long-term. So not building things that just work for the crisis, but that work for the longer term. So coming back to the podcast, when we stood up the podcast, we talked about what to name it. And you might see that CNN or others have lots of COVID-19 podcasts out there. We decided to call it Public Health on Call because we wanted it to be a product that would live on. And so we would build all of these people that would subscribe to the podcast right now because they're interested in COVID, but we always knew we would eventually expand the topic set. And we wanted this to be a product that would live on. And so we called it Public Health on Call so that we could evolve it and hang on to it and not just sunset it when the pandemic is behind us. And that's how we've evolved the newsletter as well, from the COVID-19 Daily Roundup to now what we call the Expert Insights newsletter. And we're starting to broaden the topic set to introduce more topics, which is great because there is a lot more work going on at the school and a lot more knowledge to be shared, even beyond COVID-19. And so in terms of resources, and I'm always very mindful of time because I was a TV news producer. So if I was told 10 minutes, I'm gonna make sure I'm under 10 minutes. But I would definitely love if everyone here subscribes to the newsletter. You can find it here, or you can also just go to jhsph.edu/subscribe. And I would recommend this for a number of reasons. One, you'll be able to stay up to date on the content coming out of the school. The other is you can learn from how we package and produce the content. You can look at how, to Hyang's question, you can look at how we take complex information and communicate it in different formats, which can be a great way if you're interested in being a communicator to learn from this work. And I would also love if everyone here could be a brand ambassador, what I call a brand ambassador, which is share this with your network, share it with your community. You can help this knowledge go farther by subscribing, consuming it, and also sharing it with other people. And so there's lots more I can say, but I will pause there and answer questions.
Thank you so much, Lymari, for that really, really, informative presentation. So my question to you is that there's often a tension between being an academic and being a media spokesperson or practitioner. And academic research is often very complex, while media messages need to be digestible. So how do we, as public health professionals, communicate information in an accessible yet nuanced manner?
Thank you. I love this question because it is truly at the heart of my career. The best advice that I can give you is to simplify the complex. The best thing that you can do for audiences is to simplify the complex, right? They are looking for people to boil things down and make things clear and understandable and useful, especially when you think about public health. You've done a lot of complicated research, but now that research needs to be put into action, put into use. And there is a kind of perception out there, and I think we pick it up in college somewhere along the line, that in order to be perceived as smart or credible, you have to explain things in a complicated way. I would very much recommend that you let go of that notion and to recognize that some of the most gifted communicators, what their true gift is taking complicated ideas and communicating them in simple ways. And if you aren't sure how to do that, the best tip I can give you, I always tell people step away from the computer, actually. We tend to overcomplicate things when we sit down to write, but step away from the computer and think about how would I communicate this in conversation? When we're in conversation, we tend to simplify things. We tend to get to the point a lot more quickly, and we tend to kind of translate things in conversation. So I would say, think about how you would explain it to your mom or to a friend that knows nothing about this topic. Verbally, we tend to kind of get to the point and simplify and use more conversational language. And it works great for media interviews. But then also, if you have written communication, just know that by simplifying things, you're doing better service to your audience than by keeping things really dense or only accessible to people who are really deep into that field or area of expertise.
Fantastic. Thank you so much. I don't know about you all on the call, but I certainly wrote down some of those tricks of the trade, and I'm looking forward to implementing them myself. So next up, we have our student co-leader, Zia. Zia, the floor is yours.
Hello, good afternoon, everybody. So I'm Mohammad Ziaur Rahman. I'm from Bangladesh. So I'm staying at the capital right here now at Dhaka. So I'm a medical doctor by profession. So I thought this session could be very much learning platform for me, because being a doctor, what I see and feel in our country, like the communication gap from the media, doctor and patient is really a higher bar of the communication gap. So I thought like that this would be a helpful occasion from me to learn from all the expert communicators. That's why I applied for this session to be a colleague. So now I want to introduce Dr. Crystal Watson, who is our next speaker. Dr. Crystal Watson is a senior scholar at Johns Hopkins Center for Health Security and assistant professor in the Department of Environmental Health and Engineering at Johns Hopkins Bloomberg School of Public Health. Her policy research focuses on public health risk assessment, crisis and risk-based decision-making, public health and healthcare preparedness and response, biodefense, and emerging infectious diseases preparedness and response. She also conducts research on the funding and management of biodefense and health security in US federal government. From 2012 to 2013, Dr. Watson served as program manager for the Integrated Terrorism Risk Assessment Program of the US Department of Homeland Security, Science and Technology Directorate. The IRTA program is mandated by presidential directive and linked to decision-making in a number of parts of the US government, including the Department of Health and Human Services, the Department of Defense, the Intelligence Community, the Environmental Protection Agency, and among others. Dr. Watson earned a DRPH in Health Policy and Management 2017 and an MPH in 2009 from the Johns Hopkins Bloomberg School of Public Health. She is also a BA in Molecular, Cellular, and Development Biology in 2004 from the University of Colorado Boulder. With all of it, I welcome Dr. Watson for her presentation on this topic. Dr. Watson.
Thank you so much, Zia. Thank you for the introduction, and thanks for inviting me here today. I am really pleased to present to you all, especially because I have been in your position. I was an MPH student there at the school and a DRPH student, and Dr. Burke, who you'll hear from in a few minutes, was my advisor during my doctoral degree, at least until he left to go to the EPA, which he'll tell you more about. So I think my presentation will be a really good follow-on from Lymari, and I'd like to say thank you to Lymari, because all your work at getting all of our work out there in the world has made such a big difference. And so I want to talk a little bit about the different formats that communication about the knowledge that we have can take. So how I can get my research and my knowledge from working at the Center for Health Security out into the world and hopefully make a difference in the response to this pandemic. So first, I'd just like to say I was not prepared to do all of the communication that I've been doing over the last several months. I've been working for the Center for Health Security for a long time, about 16 years, but I started out as an intern. I worked my way up, I got my degrees, and I'm now an assistant professor in the school. So I mostly work in on my work at our center and haven't had that much interaction with the press previously. And so I kind of, like everyone in this response, had to jump in with both feet and really learn as I've gone along. So I'll talk at the end. I'll give you a few tips that I've learned, but it didn't necessarily come naturally to me, and it took a lot of practice, actually. So you can feel good about that. It's not, I don't think that I am born to be on TV or to talk to the press necessarily, but with a lot of practice, I think I've gotten a lot better at it. So anyone can learn. If I can, then anyone can. Okay, so I'm going to share my screen. I just prepared a couple of slides, which I thought would give you something to look at and visualize some of this. There we go. So there are a few types of communication that I've been working on with my colleagues at our center that I think are important to note here. So first, there is communication that comes out of our scholarly work. So the research that's ongoing, this can be a little slower because, especially with a new disease like this, we don't necessarily have a lot of scholarship ready to go. But it's really important, obviously. We want to build the knowledge base. We want to have accurate and science-based information that we put out there. So one thing that I'm doing is working with the World Health Organization on a project to estimate the burden of disease from COVID for countries around the world. So I hope that as that progresses, it's making progress, but as we get that finished, then I will be able to communicate findings from that work, both through the WHO channels as well as through journal publication. But in an emergency, there are other forms of work that can be done that can then be communicated to influence the process of a response. And so these are, you can see on your screen now, these are a few examples of reports that I've worked on over the past several months with colleagues to take our knowledge from the past work that we've done. So at the center, we focus on major epidemics and disasters all the time. So it's not just in COVID. We do this work in an ongoing way. And so we have a lot of experience and knowledge that we've accumulated from the past that we could bring to this response. And so we needed to be able to get that out quickly, especially during COVID, where we noticed around late March that there was kind of a vacuum for a national view of some of these big issues to improve our response to COVID-19. So we worked on a national plan to look at how to reopen more safely, a national plan to enable contact tracing. We've released some toolkits, risk assessment toolkits for businesses to understand their risk, to look at mass gatherings and whether they should be held. And our most recent one was to look at how universities can come back more safely in the fall. So these were informed by our experience, and we were able to put them together quickly based on the evidence, but not from a prolonged period of research. So I think that's a good format to communicate in a crisis like this. Another way that I have been working to put information out and to make sure that we're trying to improve our response through actively informing the policy debate and the practice debate is to work with media partners. So I've been doing interviews, but I've also had some closer ties with some media members. This is an example from NPR. Selena Simmons-Duffin has been doing some ongoing surveys of states to try and understand what the contact tracing workforce is like and what states are doing to expand contact tracing in response to COVID-19. And so I have been working with her a little bit, and we hope to have actually a partnership going forward to put some of this information hopefully on some of our websites and track this information so that states can learn from one another, that we can have a national view of what's happening, and so Congress can also understand what's needed in terms of additional resources. So this is another format that I think has been really interesting. It's really been really great to actually cultivate these relationships with a few key partners in the press, and they've been really receptive to working together and having more in-depth conversations. So that's not something I'd ever done before, but it's been really valuable, I think. And then there are these other formats that Lymari talked about. So working in more traditional media, I've done some TV interviews, lots of press written press interviews. It's been an experience. I have been doing these TV interviews from home. I never actually have gone into one of these studios, which still seems really intimidating to me. But I took some training about at the end of March, some media training to help me prepare for particularly the TV spots that I would be doing. And I have to say, I have gotten a lot better at them. When you have a message that you've honed and you really know what the key points are that you want to get out, and you are confident in the content of your message, it makes it a lot easier. And repetition is really helpful too. So I have really come a long way in terms of these media interviews. The podcasts have been extra fun. I think I like that approach to communication the most out of all of these that I've experienced so far. So obviously the Public Health On Call podcast, where we get to talk to our colleagues and have a conversation about the work we're doing, has been really great. And then I just wanted to highlight a couple other ones that I was so thrilled to do, which was the Bill Nye Science Rules podcast, because I've been listening to science communication from Bill Nye since I was a kid. And so I was really happy to be able to go on there and be a communicator myself and talk to him. And he was really fun to talk to. And other podcasts that I personally listen to, so the 538 podcast, for example, the politics podcast, I got to talk to Galen Druk and do an interview on that podcast. So it has been a really interesting time. I think I feel the weight of it. It's a lot of responsibility to communicate during a crisis like this. You want to get it right. You want to be helpful. You don't want to inadvertently harm the response in any way. So I've taken it very seriously, and hopefully it has added to the conversation. I think that it has. But some tricks of the trade are, it's actually helpful not to overthink an interview beforehand, but to have your key talking points going in, because what I've experienced is when you get on, whether it's TV or radio interview or in print media, if you get on with the interviewer, you never really know where the interview is going to go, what questions they're going to ask. And so if you can always bring it back to your key messages, pivot if you need to, but make sure that you get your key messages out there in spite of maybe other questions that are being asked. And one thing that I've learned is, particularly with print media, they usually ask you if you have anything else to share at the end, if there are any other questions they didn't ask you. And it's actually a really great opportunity to have a key message that maybe they didn't ask about, you weren't able to get into the interview, have that ready to go, and make sure that that makes it in. Let's see. The last thing I want to do is just plug a class that we are just starting. My colleague Tara Kirk-Sell, Dr. Sell, and I have just stood up a class for first term, which is Public Health Emergencies, Risk Communication, and Decision Science. And so I talk a lot about the decision-making process and how we can make that better, and Dr. Sell talks about risk communication. So because that is the topic that we're on today, I wanted to put that out there, and we would welcome any students who want to join the conversation there. We hope it's going to be a really good term. And with that, I think I'll stop.
Thank you, Dr. Watson, for your nice presentation. So I have got a question for you. Like, we know that a lot of vaccine candidates are being developed around the world. So my question is that how can we best deliver the eventual COVID-19 vaccine in low and middle income countries?
That's a great question, and I think there are a lot of aspects of that question. One thing that I am really concerned about, and I think that WHO is really concerned about, is that initial allocation of vaccine, especially if we have many different types of vaccines, which I think is possible. If manufacturing of vaccines is primarily in high-income countries, not necessarily low and middle-income countries. So I think it's really important, ahead of even having any vaccine on the near horizon, that we need to figure out what our process is going to be to make sure that allocation is fair across the world, that low and middle income countries have as much access as high income countries. And so I know WHO is working with an organization called CEPI to try and set that system up now. But I think that's one major aspect. Once you get down to the more operational level, it's making sure that vaccines that we have we are distributing to low and middle income countries are easy to administer. So there are some vaccines that are in the pipeline right now that use alternate routes of administration, for example. So maybe not the traditional needle and syringe. And so hopefully some of those will get through. They can help avoid the need for cold chain, especially if we have to deliver vaccine in more remote locations. So I think that's really important. And then there's obviously a huge communications component around this, making sure people understand what the process was to develop these vaccines, to reassure people that there were not shortcuts taken in terms of safety and efficacy. To understand how the vaccine will act in populations is really important, and to address any hesitancy that individuals may have in taking the vaccine otherwise. And there are much better people working on communication around that right now. Some of my colleagues are very focused on that issue in particular, but I think that's something we also need to start planning for now. We can't wait till a vaccine is ready to go to have a communications plan in place.
Thank you so much for addressing that growing and important topic. With that in mind, I'm going to transfer it over now to our student co-leader, Scott. Scott, the floor is yours.
Thank you, Jennifer. Hey, everyone. I'm Scott Goldman. Great to be here. I'm currently calling in from Washington, D.C. And before coming to Johns Hopkins, I worked as a paralegal at a D.C. law firm that specialized in regulatory compliance for matters involving the Food and Drug Administration and the Drug Enforcement Administration. So that involved food, dietary supplements, medical devices, pharmaceuticals, and biologics. And I'm currently in the MPH MBA dual degree program. And my interest in this session came from a course that I was involved with called Digital Health Strategies to Control COVID-19. And public health communication has been a real cornerstone of that course, talking about how we get the message out, and getting that message at the local, national, and global level is clearly very important. The course is led by Dr. Samisha Agarwal, and I highly, highly recommend it. It is my pleasure to introduce Dr. Thomas Burke, who has been a part of the School of Public Health for 3 decades. He received his MPH from the University of Texas and his PhD in epidemiology from the University of Pennsylvania. Dr. Burke is a professor in the Health Policy and Management Department and is also affiliated with the Departments of Environmental Health and the School of Medicine Department of Oncology. Dr. Burke's work synthesizes science, policy, and communication. One of his goals is to ensure that knowledge from Johns Hopkins is translated to the front lines for the good of policymakers. He's the director of the Johns Hopkins Risk Sciences and Public Policy Institute and was nominated by President Barack Obama to serve as EPA Assistant Administrator. Dr. Burke served as the EPA Science Advisor from January 2015 to January 2017. He has also served the state of New Jersey as the Deputy Commissioner of Health and as the Director of Science and Research for the New Jersey Department of Environmental Protection. Initiatives led by Dr. Burke were key for the establishment of national programs such as the Superfund, Safe Drinking Water Act, and the Toxics Release Inventory. Dr. Burke is the recipient of the Undergraduate Public Health Golden Apple Award for Teaching Excellence and the Ernest Lyman Stebbins Medal for Outstanding Contributions for Education, among several other awards. And before I hand the mic over to you, Dr. Burke, I have a question for you. My question is, how should public health communications during times of crisis take into account the significant amount of inaccurate information that we as the public are exposed to?
Okay, Scott, you tricked me by starting off with a question, and what a great question for now, because I do have some slides to show, but boy, are we getting conflicting messages, right? We just think of COVID, and I'm going to talk about a lot more than COVID, but what do you do when your responsibility as a former commissioner of health or the head scientist for EPA, when you are in the national spotlight under the microscope, and there are so many conflicting messages, and there always are in public health. In my field, environmental health, the climate change message has very well paid advocates to try and push at different directions to obscure the science sometimes. So what do? Follow the science, all right? There's lots of misinformation out there, and interest groups will work against you, but you have to really understand what you're up against here, especially in the era of Twitter, where everybody can react, everybody can make their own news. And so it's very important that you follow the science, but don't go it alone, that you have credible scientific background, like Johns Hopkins University, like the National Academy of Sciences, where you can build that trust. But I think the most important thing to answer your question is, it doesn't begin when you suddenly get faced with a tough press communication issue. It begins throughout your career, where you build trust, where you build credibility, and you are consistent in following that science. And that's what I've always followed. I never felt compromised, and I always felt a little bit free to speak truth to power, because the truth of scientific evidence is so important in a crisis. So now I'll begin. And Jennifer, if you can help me with my slides, because I don't know how.
Absolutely, I'm working on it.
So thanks so much for having me in this class, because I actually think public health communication is the most important thing we can teach public health students. That these are the times of COVID, but not all of us have the privilege of being national and international spokesperson like Crystal, and but I can guarantee this. First of all, you will all face crises. Some of them are very localized. They might even be in your hospital or in your institution or in your town. But as you move forward in your public health career, communicating in a crisis might be the most difficult challenge you have. And one of the reasons for that, and we look at COVID now, because it usually involves communicating with incomplete information in the absence of firm scientific information. And in the case of virtually every major issue I've been involved in, there are major consequences. If you louse it up, people die. It's often really politically charged. I have a picture. Look at Trump looking at Fauci there now. I can't tell if that's jealousy or total awe. I like to think it's total awe. But we all know of the friction between the scientific community and the president right now. And there are multiple audiences, and they need very different information. But the most important thing is, without communication, we cannot succeed. And good communication determines our success or failure. Next slide. So a little history. First of all, don't think this is something that people who have been professors for 30 years do. I want to take you back to my first days at public health school down in the University of Texas. I had the cool hairdo. I was a great basketball player, tall, skinny kid. And 3 months after completing my MPH, I took a job with the New Jersey Department of Environmental Protection. And I did my first major press event that made national and international news, live coverage by the New York and Philadelphia media in the state of New Jersey. And I was chosen because of my epidemiology background, and probably because the governor didn't want to do it, to respond at a public forum to a outbreak, a leukemia epidemic as it was portrayed in the media, in a public school in Rutherford, New Jersey, a little town surrounded by chemical plants, a town where there was real concern. And in this case, there were 5 young children in that elementary school, the Pierpont School, with leukemia. And they wanted answers. And I just have to tell you, I learned a lesson really quickly at my first public appearance in a jammed auditorium with all the live broadcasts going on, where I had to give a summary of the state's effort to try and understand and investigate this cancer cluster. And a woman stood up in the auditorium and said, "Mr. Burke, I don't care what kind of science you're doing. You'll never bring my baby back." And she burst out screaming, crying. She ran from the auditorium. All of the cameras followed her. Clearly, that was the big news story, the emotional moment. But I understood the power of emotion, the importance of being able to be sympathetic and compassionate, but also to try and put forward the best scientific information possible. It was a very humbling experience and a very important learning lesson at the humble age of about 24. Next slide. So I've had a great ride, from the Dr. Oz show to working with the President of the United States. I got a call in my office at Hopkins and from the office of the President, and they said, and my secretary Robin says, "Tom, it's the White House." And I said, "Well, put them through." And it was the director of personnel for the office of the President who said, "Dr. Burke the President would like you to join our leadership team." And I'm like, okay. And then I went down, when can I come down and start the vetting and the interview process and everything? And I got the job. But I just want to mention something. One of the greatest interview questions in this very long vetting process was the final question, and that was from the administrator of EPA, who I would work directly for, Gina McCarthy. We went out to lunch, and it was the interview. And, I have my suit on, and I'm all ready and very well prepared. And we're just having a good time talking. And I said, "Well, Gina, do you have an interview or question for me?" She said, "I have a question." And here was the question: "What are you afraid of?" Think about that. Write that question down. What are you afraid of? So I'm from Jersey, right? I'm from Jersey City. I grew up, in a tough kind of neighborhood. I'm an Irish guy. And I think, wow, that's the greatest interview question I ever heard. So here was my answer: nothing. And I got the job. It was a short conversation because I realized if you're going to be in a leadership role, particularly a controversial leadership like the Environmental Protection Agency, and you're going to have to take on hard things, you have to be fearless. And I'll get to more of that later. Next slide. So first, we've heard a lot about COVID and things, and everybody's thinking about, the big interview. And it's cool to be on Rachel Maddow, and it's cool to be on news shows, but I have to tell you, communication is a lot more than that. This is a picture behind the scenes where I'm briefing the leaders in Flint, Michigan, and there, Gina McCarthy, the former administrator of EPA, is on the far left there, and I'm talking to them in very understandable tones about what we're about to do, have a major press conference to announce the president's emergency order to respond to the Flint, Michigan drinking water crisis. And so there are big moments on TV, but most of your communication, which is really important, will be short briefing documents, explaining tough things to non-scientists and decision makers, congressional briefings and hearings, talking to local officials, public meetings, crafting a press release, and developing the frequently asked questions to prepare, doing press conferences and news shows. But also in today's era, it's really important, as Crystal and Lymari have said, to understand and use the vehicle of podcasts, blogs, tweets, and in my case, LinkedIn. I have thousands of people reading my science papers now because I kind of translate them in LinkedIn. Next slide. So I wanted to talk a little about Flint because I was the head scientist at the agency during what I think one of the most tragic times. And it truly was a crisis. It wasn't a national crisis, but it was the poisoning of an American city. And that's the kind of press we got. And it was tragic. And I was under the microscope. And I tried to provide the scientific underpinnings to make the problem better, to address the problem, but also to help communication of the problem. Next slide. So this is a photograph of the big press conference. As you know, Flint went on for a long time without the appropriate attention, and it took an executive emergency order from the President of the United States to really mobilize the full powers of the US with the Department of Health and Human Services, the CDC and EPA to declare an emergency and take over things in the state of Michigan because Michigan had dropped the ball in providing clean water to the people of Flint. Next slide. Now, before the press conference was the most important meeting, and that was with the public and with the people and the leaders. And that was a humbling one, because Gina McCarthy introduced me and she did all the cool things like Scott did, to say, you know, all the schools I went to and all that. And a pastor, a leader, stood up and said, Dr. Burke, all due respect, we don't need no science projects. We just need clean water. And that's what they wanted. And it reminded me, remember your roots, remember why you're there, and remember the people that you are serving and trying to help. Next slide. So, little advice for success. First, listen. Understand what your audience needs to know and wants to know. So much of our communication in public health is so paternalistic and like we have the answers. Listen first, learn about your audience, and let them know you took the time to understand about them. Secondly, prepare. Don't ever go up in front of that podium at a public meeting or a newscast or a podcast where you didn't study harder than you ever studied in your life. And then Lymari and Crystal talked about this. Explain things clearly. Now, for me, my mom was an Irish washerwoman, a cleaning lady. She had a 6th grade education. I grew up talking to my mom. Still to this day, whenever I do a public meeting, I want to make sure my mom can understand, because she's there. She's listening to me from somewhere good. So talk to mom when you're making your presentation. Don't make stuff up. Sometimes you get asked really tough questions, you speculate. Don't go there. Go with the evidence. Tell the truth. It's okay if you don't know the answers. And we don't always know the answers. Most of the time we're working with very incomplete information. Just look at COVID. Stay in touch after the announcement. A press release or a press conference doesn't end the conversation, it starts it. You have to be open. You have to have that two-way conversation. You have to have that follow-up. As we see with COVID, it's a longitudinal process here, and we're in for the long haul. And then getting back to fear, be fearless. Speak truth to power. Next slide. And I think this is my final tricks of the trade. First of all, I never go anywhere without an index card with my key messages on it, even tonight, right? Now, second, Know your boomerang. And what's a boomerang? Well, Crystal talked about it. She talked about pivoting. You can be in control of a press situation, of an interview, if you know how to boomerang. You'll get a crazy question, but you might say, that's a really good question, but the most important thing I want to address today is this. That's called a boomerang. Watch some of the really good communicators like Crystal, and she'll get back to those things on her index card. Remember to be humble and say thanks. Tony Fauci's amazing with this. The most hostile question from the most hostile senator, and he thanks them for the question. They coached us on this for Senate hearings and Senate confirmation things too. And now I'm going to give you a little trick from my deceased brother who started a great communication course that we continue here at Hopkins. When all else fails, what do I mean by this? Cough. Well, I actually had to use this once on a TV taping for a major segment of a news magazine show, a national show about environmental contamination. And I felt the question was very unfair. It took me by surprise, and I started to answer, and I knew this was kind of one of those killer questions, and so I did this. Excuse me. All right, that sounds pretty convincing, right? I bet you guys thought I was really coughing. Well, I wasn't, but I have rehearsed that just as I have rehearsed my bottom line. It will stop the taping. The sound man will go crazy, or sound woman will go crazy. They will cut, and they will give you 10 minutes because they have to set up again, and then you'll be really ready the next time. So those are my tricks of the trade, and I'm happy to answer any other questions. And come by and see me by Zoom, and when we really get back to school, I can't wait to meet you guys. Thank you.
Oh gosh, thank you all so much. I don't think I speak just for myself when I say that I wish we could continue to hear advice and stories from the road and tricks from the trade from our panelists. And appreciate all of you staying on with us. We know that we've gone over a few minutes, but I hope you agree that it was worth it. If you're like me and the student co-leaders and are eager to continue this conversation, April will be sending out a link in an email to direct you to the Zoom after party for the students. But now, please join me in a virtual thank you to our panelists and our student co-leaders for a really remarkable session. We really appreciate you.
Thank you for having us. This was really fun.
It was fun. Thank you.
Thank you so much.
Ash, I'm sorry, I'm going to add one more thing that I meant to mention there, just to say that the Office of Public Health Practice and Training is working on a Slack page, and we will share the resources that have been addressed throughout the course of this presentation on that Slack page. You'll soon be receiving more information about that, but just wanted to let you know that you will eventually be able to access these different resources in case you weren't furiously writing them down. So thank you all very much and have a great evening. We will see you soon.
Enjoy the after party.
Yes.